Neurofibromatosis type 1. Today we're going to be talking about this topic as one of my followers asked me to talk about it. So there are two types of neurofibromatosis, type 1 and type 2. Type 1 is more common than type 2. The symptoms of neurofibromatosis is the development of neurofibromas, which are benign tumors at the nerve endings. It can happen throughout the skin. That's why it can be apparent to people with having neurofibromas, what we call, or benign tumors on the skin. Of course, it can happen on any nerve. So it can happen in the nerves in the brain or the spinal cord. Patients with neurofibromatosis will have what we call cafe au lait spots, which are brown spots all throughout the skin. This is a hereditary disorder. This is a genetic mutation in one of the genes in the body to form this abnormal protein. Now, if the husband or the wife has the defect or the gene, the mutation, then this increases the risk of the children have it. And at times you have the mutation with spontaneous, without having a parent with the mutation. Now, we ask those patients to follow up closely with neurologists for the diagnosis because the neurofibromas or the benign tumors can develop on any nerve ending. So it can happen in the brain or the spinal cord. That's why we do an MRI of the brain and the spinal cord. Now, although they are benign tumors, but they can compress the surrounding structures, causing symptoms. It can cause pain, it can cause problem with hearing, it can cause also weakness, and it can cause seizures. That's why if they happen to be in the brain or the spinal cord, they must be followed up by the neurologist. Also, those patients are unfortunately at an increased risk of developing other cancers, including breast cancer, leukemia, or colon cancer. Therefore, they have to follow up with their internist for early detection of these cancers and treatment. Thank you.